So today we're going to talk about the anatomy of esophagus. Esophagus is a 25 centimeter long fibromuscular tube that extends from pharynx to cardia. It has two sphincters, three constrictors, and four layers of different histological subdivisions. Now, talking about the sphincters, there are two sphincters, an upper sphincter and a lower sphincter. Upper sphincter is made up of cricopharyngeus muscle, which is an anatomical sphincter, and it acts during the process of swallowing to allow the food to pass from the pharynx to the esophagus. The lower esophageal sphincter, it is very important. It is physiological one on one end, and number two, it is present at the gastroesophageal junction. Now, the patency of lower esophageal sphincter is very important because it prevents the reflux of food from stomach into the esophagus. Only 1/8 of the distal esophagus is resistant to the acidic food. So if acidic food comes back from the stomach into the esophagus, it will cause erosions and eventually lead to a disease named as gastroesophageal reflux disease, known as GERD. Now, GERD will eventually, over a period of time, could lead to Barrett's esophagus and eventually adenocarcinoma of esophagus. So talking about the constrictors, there are three constrictors of esophagus. The question is that why do we need to learn about these sphincters? The answer to this question is that whenever a person is performing the endoscopy of esophagus for any reason, he or she must be aware of the normal constrictions because otherwise they may cause perforation of esophagus. Now, the first constrictor, is present at pharyngoesophageal junction, which is at the level of sixth cervical vertebra, that is approximately 15 centimeter from upper incisors. Now, the second is actually a combination of two points, that is arch of aorta and left main bronchus, which is 25 centimeter from incisors and at the level of fourth thoracic vertebra. The third constrictor of esophagus is present where esophagus passes through the diaphragm, which is approximately 40 centimeter from incisors. Now, talking about the four layers, the important question now would be why do we need to learn about these layers? Now, answer to that is the knowledge of these layers help us to quantify on endoscopic ultrasound the T stage of esophageal carcinoma. Now, number one, that there is mucosa, then there is submucosa, and then there is muscularis layer and fibrous layer. The mucosa is further divided into three subdivisions, that is epithelium, lamina propria, and muscularis mucosae. The epithelium of esophagus is stratified squamous epithelium. Submucosa is responsible for the production of secretions into the lumen of esophagus to allow the easy passage of food from esophagus into the stomach. Now for this, there is a plexus, Meissner's plexus, which supply the different glands which produce secretions. Then comes the muscular layer. Muscular layer is an inner circular and outer longitudinal. It is divided into these two parts, and in between these two parts is the orbax or meningeal plexus, which is actually responsible for the conduction of nerve impulses through the neurons that makes the process called as peristalsis, which allow the food to pass from esophagus rather from the oral end to the anal end of the gastrointestinal tract. Talking about the fourth layer, the adventitia, it is basically just the connective tissue. Now, talking about blood supply, venous drainage, and lymphatic drainage. For these purposes, there is a division of esophagus into three parts which help us to remember each blood supply, venous drainage, and lymphatic drainage in a much kind of a memorable way. Now, the cervical part of esophagus is supplied by inferior thyroid artery and inferior thyroid vein. So it is a similar thing to remember. It's an easy way to remember them that there is the same name. There is just difference of the word artery and a vein. Then comes the lymphatic drainage of this part. It is deep cervical. So again, the common word cervical part is drained by lymphatics that are deep cervical lymph nodes. Now comes the thoracic part. Thoracic part is supplied by bronchial arteries and branches from thoracic aorta, and it is drained by venous system, that is hemiazygous and azygous veins. The thoracic part is having lymphatic drainage into the posterior mediastinal lymph nodes. Now coming to the third part, the abdominal part of esophagus is that part which is present in the abdominal cavity that is below the diaphragm, and before entering into the cardia it is approximately 1 to 2 centimeter. It is a very small part. Now, it is supplied by inferior phrenic. As I already said, it is below the diaphragm, so it is easy way to remember that it is inferior phrenic vessel that's supplied and the left gastric artery. Now, the left gastric vein will be its venous drainage, and gastric lymph nodes will be the lymphatic drainage. Now, another important point regarding division of esophagus into upper one-third, middle one-third, and lower one-third is that the upper one-third is having striated skeletal muscle, the lower one-third is having smooth muscles, and the middle one is having a combination of both. Talking about the nervous supply, the parasympathetic nervous supply is by means of vagus, and sympathetic nervous system is being supplied by sympathetic trunk. Now, a quick revision for anatomy of esophagus is that it is one 25 centimeter long fibromuscular tube with two sphincters, an upper and a lower, with three constrictors and four layers. Thank you for listening. If you like my lectures, kindly like, share, and subscribe.